Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the show.
Hello.
Dr. Mark, Dr. Gwen, talking about strep pharyngitis, or strep throat, as you may have heard it, or experienced it.
I've had it before.
Had
You know the only thing worse than strep throat?
What's that?
Having strep throat on Christmas. That happened to me once. I remember that. And I remember, like, I don't have a way of getting antibiotics, and I want to get these started quick so I'm not contagious.
Oh, this was when you were a kid.
No.
I was
This was
like
when
Christmas when we would get together.
This was when I was in medical school, I think. Because I was at my wife's parents' house. So I took some of the kids' leftover amoxicillin. Anyways.
Well, how did you diagnose it as strep?
Centaur criteria.
Centaur criteria. We'll be going over Centaur criteria. In fact, we should just do a sample of Centaur criteria to show patients what we use, the tool that we use.
Yeah,
like
sure.
when my kids call me asking questions.
Yeah. Is this strep, Dad?
I teach them to use tools on MD Calc, even the ones that aren't in healthcare.
Yeah, that's what we use.
So, and we do have chat, so we can talk live, because this is a live stream at 4:30 on April 10th.
No, it's not.
Monday.
We're living in the future.
And in case you're watching this after the fact because you're interested in the topic, a doctor who's actually been vetted by YouTube, although that may not be on the channel just yet, but it's coming.
Us.
Yes, we've been
We've
told.
been vetted.
We've been told we're official healthcare providers according to YouTube, so that we're happy with that.
My license also says that.
Yeah,
and my board certification also claims that.
And a diploma from a medical school. That factors in there too.
Those things kind of say a little.
So, yeah, I guess YouTube isn't quite the authority, but
maybe
if that matters to you.
Maybe in some people's eyes. I could go to this guy that has this diploma on the wall, but YouTube, I don't know.
Well, the guy on YouTube has a diploma.
Wait, we got something on our wall, so.
Wait, oh, yeah, that's YouTube.
YouTube. That's what we got.
We should have that in the patient room. We should have that in the exam rooms.
That's what we need.
So patients know that we're actually
by YouTube.
For real.
Just have like a
silver play button on the wall. So if you came here just to learn about strep throat and no funny business, click away. And we're going to continue having fun while also getting around to talking about strep pharyngitis and its treatment and the current things going on in the news about it, because it is a hot news item for the week. I learned that from NPR. That's what came up with a strep story. So that's what I do. I'll look and see what are the health news things, and I was going through them today, and I saw that, strep pharyngitis, that's actually a good topic. And so apparently, we'll just jump right into it. We are looking for the chat, though, too. If you guys have chat, you can put in your questions or comments. But it said, the article, that there's a lot more strep than usual. Sounds like some other respiratory type illnesses we've been dealing with.
Yeah.
Others being viral,
We have
strep
been
bacterial.
seeing a lot go around lately.
Yeah. A little different year.
Yep.
And we have an explanation for that. Because it's been different last few years. And then the other thing was not only more cases, but also
treatment.
Loss of the treatment of the certain, I think it's the 400 milligram per 5 ml amoxicillin liquid that we use in kids. Apparently you can't get it. And you go to the end of the day, the doctor sends in the prescription to the pharmacy, and then they're closed when you get to the pharmacy and find out we don't have any, and the other pharmacies in town don't have any.
Yeah, we got to send that back, but then the doctor's office is closed, and you're up the creek.
So
it's a good thing.
So you have to use a different strength, or teach a kid to swallow pills, or use an alternate.
Yeah, or alternate treatment.
Yeah, which it's just we recommend the
not
penicillin.
Recommended because penicillin's first line.
And actually, that's what I'd like to point out is. Oh, penicillin, isn't that an old one? Isn't the resistance to penicillin, isn't it been replaced by the azithromycin and the other drugs? Not for strep throat.
Not for strep, actually strep is.
As of the last reference I just checked today, there still has never been resistance of the type of strep that causes strep throat to penicillin. So why strep? Why are we treating strep throat? It goes away on its own.
It does go away. So if you have strep throat, the natural course is if you wait long enough, your symptoms will go away. You will feel better. But has the infection gone away or just gone somewhere else? Wow, that was like we rehearsed that. So the reason we treat it is because we don't want some of those follow-up infections called sequelae that can happen. So that would be like...
Yeah, why don't we talk about things like a kidney infection?
Kidney infection, post-streptococcal glomerulonephritis.
Or a heart valve infection?
Yeah, oh gosh.
Rheumatic valve disease.
There
yeah.
you go, rheumatic valve. Why can I not think of the name of that?
That's why there's two of us.
Yeah.
Helps it flow
and then
better.
you can just get the strep rash. You've seen that with kids?
Scarlatina, yeah.
Scarlatina.
Scarlet fever, that's what it is. That's what scarlet fever is. It's not that they get a rash in the shape of an A. It's actually that they get this rash that has a certain like sandpapery feel.
It kind of has that rough.
Can you feel it, or is it just looks?
It looks like it. Yeah,
I'm sorry.
It,
it's not a
it
feel.
doesn't feel like sandpaper.
Correct.
It's not rough like that. But
Don't rub your hands on the kids when they're sick.
I mean, you can.
Well, you can. Sometimes it makes them feel better. Rub their back. We had one. He loved that.
Yeah.
Still does. I like that.
Yeah.
Well, not from just anybody.
Yeah. That's the reason why we treat, because we don't want it going into those. Some of those can be detrimental long term. Like you can get kidney impairment, kidney infections that can cause long-term kidney impairment. Or you can get rheumatic heart disease, which can actually cause valvular disturbances where the valves don't work as well. And you can start to get, aortic regurgitation where the blood's just not flowing as well. So that's the reason why we treat. Okay. That's kind of the big reason.
So we have a question from
Ooh, yeah.
VM. Is that strep A?
Oh, great.
Strep
Gas.
A.
G-A-S.
G-A-B-H-S?
Group A, beta-hemolytic.
It is
Boy,
strep
you're
A.
using a lot of words there.
Group A, beta-hemolytic strep.
Those all mean something.
GABHS. Yeah. But yes, group A strep.
That's
what we're
when
talking about.
when you're culturing it. Yeah, those all stand for something where it cultures.
Yeah. So when I think of group B strep, I think of
pregnancy,
and it's actually a vaginal infection that you get rid of.
Yep.
In pregnant
that you treat
patients.
just prior to delivery.
But otherwise, you leave it alone.
Yeah. Otherwise, it's a colonization.
Yeah. But yes, this is group A strep. Responds very nicely to
penicillin,
plain old penicillin, amoxicillin, Pen-VK, or you can give benzathine, penicillin, an injection, and somebody who you think isn't going to take their pills, or can't fill the prescription at a pharmacy, but you could give them the pills.
For those who are allergic to penicillin, and if you are, check with your doctor on that one. There is a second line, which would be azithromycin, which maybe you've heard of, the Z-Pak, or ceftonir or cephalosporins can be.
Sometimes you can take cephs if you're, sometimes.
Yeah.
So thank you, VM, for the comment and the question.
Yes, group A strep. So that's why we treat, but back to the Centaur criteria. How do we
I was also going to mention, if you're waiting on a culture.
Yes, that's something to think about. So yeah.
It seems to be okay to wait on the culture before starting treatment with antibiotics. It used to be just go ahead and start. And now you can do it either way. You can go ahead and start, or you can wait for the results. It doesn't look like there's really that big of a chance of something bad happening if you were to just hold off and wait.
Right.
And we actually used to just tell people to stop taking the antibiotics once the culture got back if we started them.
Right.
Which can create resistant bacteria. So
it can.
Not a super great practice.
The biggest thing for treating more quickly would be getting people back to work or back to school, because if you treat, you can get them back quickly. If they are not having a fever and you get that first dose in them, they can go back the next day because it's been 12 hours.
If there's no fever and antibiotics,
And this was actually news to me when we were looking these things up. I thought it was 24 hours. It's actually just 12 hours. So that's
pretty cool. All right, let's see what Bianca is saying here. What's Bianca say? Bianca says it's a sore throat. If it's viral, you just need fluid and paracetamol, acetaminophen in the U.S. Bacterial, then you need antibiotics. Well, roughly,
yeah, that's a good generalization.
Roughly, in general.
There are other types of bacterial pharyngitis or sore throats, which can be a little more difficult to diagnose.
And in fact, some of them, if you can have an identical clinical picture to strep throat, you look at it, it's got big, gigantic tonsils with pus coming out of them. Kid has a fever, a little fatigued.
Yep.
And if it's not strep throat, but instead it's Epstein-Barr virus, or mono, and you give them a penicillin, you can actually cause them to have an adverse event or a rash.
Yeah.
Otherwise, it doesn't hurt them. But this rash that they otherwise wouldn't have to deal with.
Yeah.
Do you know if it itches, the Jerick-Schirschmeyer reaction?
I don't know.
Okay.
I would have to look that up.
But you don't want to give them the antibiotics for Epstein-Barr or for mono.
Mono.
It's not going to make them get better any quicker. Might make them a little more miserable with the rash.
Right. Yeah.
So you want to know. So that's why
it's very important to treat appropriately.
The Centaur criteria.
Yeah. Yeah.
Should I pull it up on here and we'll actually do it for our viewers?
Yeah. So there's Centaur criteria and then a modified Centaur criteria, which is newer and actually takes your age into account.
So I'm just getting MD Calc. I have an app. And in the search, I put Centaur, Centor, modified Centaur. And the first question is age.
This is the modified.
So 3 to 14 years of age, you get a point.
So younger people are more likely to get strep. So that's if you get a point, it's more likely that you have strep.
And then 15 to 44 years, 0. And over 45 years, actually -1. Over 45 years old, you get a point taken away.
The older you get.
Older people just don't get it. You'll notice that it only starts at age 3 because it's so rare in under 3 years of age.
Right. Yeah.
So you can't use the scoring system.
Yeah.
On the little ones. Okay. And the next question is exudate or swelling on the tonsils. So that would be pus or swollen tonsils. A point for yes, 0 for no.
Yep.
Tender, swollen anterior, meaning the front lymph nodes on the neck.
Right along the muscle there.
Yep. 1 point for yes, 0 points for no. Temperature over 100.4 degrees or 38 degrees Celsius. A point for yes, no points for no. If a cough is present,
you actually lose a point.
You have 0 points added, but if a cough is
absent,
you get a point.
Yeah.
It's the anti-cough.
Yeah, exactly. Strep is a throat problem.
It's not a cough problem.
It's a throat problem. Whereas URI, upper respiratory symptoms, often have other symptoms. Runny nose, cough.
Making it likely sore throats from whatever's going on there.
Yeah, if you have those associated symptoms. Whereas, if it's strep, it is the throat.
So that's the points. And then you get a score that is either confirmed positive, that's if you have a high score, suspected, unlikely if it's a low score, and a confirmed negative if it's really, really low score. And if it's in those two middle ones, that recommends you get a test. Yeah, that you test to find out. So I looked, and I checked the sensitivity on the rapid test that we have here in the office.
Oh, yeah.
I found it's 97% sensitive.
That's pretty good.
Yes.
So we're going to pick up most
only
things with that.
Only 3% of positives are going to make it out without getting treated. And by how serious strep is and how often they have those really, really bad effects, that's considered an acceptable percentage. I mean, it's
very good test.
So rare.
Yeah.
So that's how we do it. Mm-hmm. Should we have a song?
Should we have a song? Did we hit everything? We didn't talk about amoxicillin.
Let's talk about amoxicillin.
Because it's
you can
supply.
actually get a single day treatment, and we recommend you only get treatment if you need it. So that's why we like to use the Centaur criteria to come up with who's likely to need it, and then test them, and then we treat with just plain old penicillin.
Good old penicillin.
Is that what you wanted to say? Or?
Well, I was saying that. So currently the higher dose liquid is in short supply, or you can't really find it. So, again, you can treat by pills. There are chewable amoxicillin pills, so that may be something to look into, because if these are usually kids who are getting strep throat, so if somebody does have difficulty swallowing, those chewable pills may be an option to try. Or if they can swallow, trying to find a dose that is appropriate for them that they can swallow is something you can also try. So, make sure you talk to your doctor about that if you get a strep throat. Make sure that it is treated properly. I guess that's what we wanted to do. So,
absolutely. And so that brings us to
it's like you transformed. I'm gonna move out of the way.
Fancy live editing.
You're gonna take me out with the neck of your.
Take me out.
Watch me just slide out of the frame.
Oh, I'm truly soloing. Okay.
I don't know the melody.
I know. Yeah, the song was just written today by ChatGPT. We actually tried both Bard, Google's AI chatbot and ChatGPT. And ChatGPT.
But Bard was better when we decided to have explicit lyrics. Anyways.
Yes, Bard would actually give you songs with explicit lyrics, whereas ChatGPT said it's programmed not to do that. It's programmed to be a positive influence on the world.
Well, Bard's just like, screw it.
Bard doesn't care what it does to the world. So we sampled what each of them produced, and ChatGPT was nice and actually does a much better job making a song that makes sense. And Bard can't make expletives rhyme. We'll just say that.
Spit rhymes with something.
Yeah, we did. Okay, yes, it did get that one to rhyme. But
Luck rhymes with something.
Did it do that?
I think it
I'm
did.
trying to remember. Okay. All right, so all right, let's make sure that, okay, people do think a song is cool. Melissa Sullivan says song, all right. So we will do the Chat GPT generated song Strep Pharyngitis in light of what's going on in the news with it. So there we go. I woke up this morning with a sore throat. I couldn't swallow or even tell a joke. I went to the doc, got a test. Strep pharyngitis, not the best. Strep pharyngitis, it's a pain. Seems like everyone's got it again. Can't find the medicines we all need. Liquid amoxicillin, where did it flee? Feeling down, can't eat or drink. This sore throat's making me think. Why so many cases this year? We never did get to that part. It's spreading so fast, that much is clear. Strep pharyngitis will survive. We'll take our meds to stay alive. Bit overstating it. It's just a bump. We'll get through. Strep pharyngitis will bid adieu. Adieu. Thank you. I'm here all night.
Oh, man.
Okay, so
Where's our tip jar?
it's virtual. There is a tip jar. They're just not doing it.
Oh.
Okay, so there is.
There you go.
What's it called?
Some of those were impressive rhymes.
Yeah, well, thank the computer. Here, I'll leave the hat on. I'm a musician now.
Yeah.
Okay, I'm checking for the comments though after the song.
Couldn't swallow, couldn't gloat.
There. Actually, the line I changed that one to tell a joke.
Oh.
Okay,
like
so
it.
Melissa
Okay.
Sullivan liked that there was a song, and Michael Andrew, this made my morning. Oh, I don't know where he is. It's morning, but we're glad.
Morning.
And then Dream
You're on
Weaver,
the other side of the...
Dream Weaver, hand clapping hands emoji, I guess.
I
is
see
what
them.
it
There
is.
they are. There's
You're
like
able to see it. I'm not
10
able
of
to see it
them.
over here, but thank you, Dream Weaver, for the clapping, and all of you who did the super chat.
Thank you.
I'm a positive thing. So thank you for watching us this week as we talk about strep pharyngitis, the amoxicillin, liquid amoxicillin, 400 milligrams per 5 ml shortage, but there's other strengths that you can get. Thank you for watching. Until next time, Dr. Dwayne Vaughn, Dr. Mark
me.
Vaughn, telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.